When you have cancer, you might be told that there's a possibility of a clinical trial, but are clinical trials safe? Hi, I'm Beth Faiman from the International Myeloma Foundation's Nurse Leadership Board, and I'm here to talk to you about clinical trials and whether or not they're safe in a minute or less. So clinical trials are generally considered safe for patients with multiple myeloma. In fact, the great clinical trials that we have now are so well designed, and that protocol is like a blueprint for future studies. So once these drugs are approved, then the study that we are following will give us insights as to how to give the treatment later on. In fact, patients who are on clinical trials are 14 times more likely to benefit from clinical trials than to have harm. What's really important about clinical trials too is it's voluntary, so you can learn more about the clinical trial, try to find the one that might be right for you, but you don't have to stay on that clinical trial. But you do get a dedicated support team with doctors, nurses, nurse practitioners, and regulatory officials who ensure that you get this drug safe and effectively delivered to you. So if you're interested in clinical trials and you want to find out one that might be a right fit for you, go to myeloma.org and you can go to Spark Cures to find out if there's a clinical trial in your area.